A heart attack is one of those moments that arrives suddenly, but its story begins many years before the pain ever appears. Inside the human body, especially inside the coronary arteries that supply blood to the heart, a slow and silent process starts long before symptoms become noticeable. This process is the root cause behind most heart attacks, and understanding it is the first step toward preventing tragedy. A heart attack occurs when blood can no longer reach a part of the heart muscle. Without steady oxygen-rich blood, the muscle begins to die. This happens because the arteries that carry blood become narrowed, stubborn, stiff, and eventually blocked. But that blockage doesn't happen overnight. It is the result of many small, daily choices, paired with genetic, medical, and environmental factors that shape the health of our arteries over time. Inside the artery walls, a substance starts to collect. It contains fat, cholesterol, calcium, and inflammatory cells. This mixture is known as plaque. As years pass, plaque becomes bigger, thicker, and harder. It slowly reduces the inner space of the artery. If you imagine a water pipe inside your home getting coated with grease day after day, you can understand what happens inside blood vessels. The pipe won't clog instantly, but the buildup will silently grow until the flow turns weak and finally stops. The exact same thing happens inside a coronary artery. This gradual buildup is called atherosclerosis, and it is the single most important reason behind heart attacks. Now, the obvious question is, why does this plaque form? And the answer begins with cholesterol. Cholesterol is not always harmful. Your body needs it for many essential functions. But it becomes dangerous when the levels of LDL, commonly called the bad cholesterol, rise to LDL cholesterol has a tendency to stick to artery walls. When too much of it circulates in the bloodstream, it begins to enter the artery lining and accumulate. On say 10th, the immune system mistakenly treats it like an invader. White blood cells rush to the area to attack it, but instead of clearing the problem, they get trapped and turn into foam cells. These foam cells mix with fat and debris, turning into the early stages of plaque. Over months and years, this plaque grows bigger, especially if LDL levels stay high. At the same time, the balance between LDL and HDL, the good cholesterol, matters deeply. HDL acts like a cleaning system, removing cholesterol from the arteries and carrying it back to the liver. When HDL levels are low, the body loses some of its protective ability. People who smoke, people who don't exercise, and people with uncontrolled diabetes often have very low HDL levels. When the cleaning system is weak, plaque begins forming faster, and arteries become more vulnerable. This imbalance between LDL and HDL quietly lays the foundation for a future heart attack. While plaque buildup is a slow-burning issue, the moment a heart attack occurs is usually sudden. It most often happens when a plaque inside the artery ruptures. Imagine a scab forming inside the artery wall. If that scab cracks open due to stress, inflammation, or sudden pressure changes, the body immediately tries to repair it. But the repair response is too aggressive. The body forms a blood clot to seal the rupture, and this clot can grow large enough to completely block the artery. The blockage forms in minutes, not hours, which is why heart attacks feel as if they strike out of nowhere. But the truth is, they are the final chapter in a story that started years earlier. Many lifestyle factors increase the likelihood of plaque rupture. Smoking is one of the most dangerous. With every puff of smoke, chemicals enter the bloodstream and injure the delicate lining of the arteries. This damage makes plaque more unstable, more fragile, and more likely to burst. Smoking also causes blood to thicken and increases the heart's workload. Even if someone smokes only occasionally, the damage accumulates. Secondhand smoke is harmful too, meaning even people who do not smoke but live around smokers face a higher risk. High blood pressure is another powerful contributor. Arteries are built to handle a certain amount of pressure, but when blood pressure stays high for months or years, it behaves like a constant force, hitting a wall. Eventually, that wall weakens and cracks. These cracks become perfect spots for plaque to form. Over time, constant pressure transforms healthy, flexible arteries into hardened pipes with less ability to open and close properly. Hypertension not only speeds up plaque formation but also increases the chances of plaque rupture. Diabetes is equally harmful, and in many ways, even more dangerous. High blood sugar damages artery walls, increases inflammation, weakens the arteries, and disrupts cholesterol levels. Diabetic patients often have high LDL, low H, and higher than normal triglycerides, creating a perfect storm inside the arteries. Even slightly elevated blood sugar, often called prediabetes, can begin harming the cardiovascular system. This is why people with diabetes have a significantly higher chance of experiencing a heart attack, even if they do not feel sick. Obesity adds more fuel to the fire. Fat stored around the abdomen isn't just extra weight. It is metabolically active. It releases chemicals that increase inflammation throughout the body. This inflammation doesn't stay in one place, it flows everywhere, including into the arteries. It contributes to insulin resistance, raises LDL cholesterol, lowers H, increases blood pressure, and stresses the heart. Modern lifestyles contribute heavily to obesity, and everything from fast food to sugary drinks to lack of physical activity increases the strain on the cardiovascular system. Symptoms: a heart attack rarely begins with drama, the way movies show it. In real life, the symptoms can be slow, confusing, subtle, or easily mistaken for something minor. Many people describe the earliest sensations as a discomfort they try to ignore, something they hope will go away on its own. But inside the body, something serious is unfolding. As the blood supply to a part of the heart becomes blocked, the heart muscle begins to struggle for oxygen. The symptoms you feel are the body's alarms, signals trying to warn you that an emergency is unfolding. Understanding these signals can save a life, because the sooner a person recognizes a heart attack, the sooner they can reach help, and the more heart muscle can be saved. The most common symptom is chest discomfort, but even this simple idea can feel very different from person to person. Some feel a pressure, like someone is sitting on their chest. Others describe it as squeezing, burning, tightness, or heaviness. It is very rarely a sharp stabbing pain. Instead, it often feels like deep discomfort in the center or left side of the chest. Sometimes the feeling lasts more than a few minutes. Sometimes it comes and goes. People often think it might be gas, heartburn, or muscle strain. But when the discomfort feels strange, heavy, or persistent, the body may be signaling reduced blood flow to the heart. Another classic symptom is pain or discomfort that spreads. The chest is not the only place where a heart attack is felt. Pain may travel to the shoulders, neck, jaw, arms, or back. Many people, especially men, report pain moving down the left arm. Women often describe pain in the jaw, neck, and upper back, which is why their symptoms are sometimes misdiagnosed. This spreading of pain happens because the heart and nearby areas share nerve pathways. The brain sometimes struggles to correctly identify where the pain is coming from, so it sends signals to multiple regions. Shortness of breath is another major warning sign. When the heart's ability to pump blood drops suddenly, the lungs feel the impact almost immediately. A person may feel like they can take a deep breath or feel winded, even when not moving much. Sometimes shortness of breath appears alone, without chest pain. This is especially true for older adults, women, and individuals with diabetes. They may feel breathless, walking a short distance, or even sitting still. If breathing feels unusually difficult or shallow, it may be the heart struggling to supply oxygen to the body. Treatment: when a heart attack strikes, every second matters. The sooner a person gets treatment, the more of the heart muscle can be saved, and the better their chances of survival. Treatment is never about one single action. It is a chain of urgent steps that begins the moment symptoms appear and continues long after the hospital visit. The heart is a delicate organ, and restoring its function requires speed, precision, and careful long-term care. Many people think treatment starts only when doctors take over, but the truth is, the first and most important treatment decision happens before the ambulance even arrives. Recognizing the symptoms and getting help quickly. Calling emergency services immediately is often the single most life-saving step a person can take. Delaying treatment, waiting to see if it gets better, or trying to drive yourself to the hospital can cost precious minutes and lead to permanent damage. Once emergency personnel arrive, they begin working right away. They connect the patient to oxygen, check vital signs, and perform an electrocardiogram to see if the heart is having an active heart attack. They may give aspirin on the spot, because aspirin helps thin the blood and prevents the clot from growing larger. Sometimes nitroglycerin is given to relax and widen the blood vessels, helping more blood reach the heart. These early steps may feel small, but they can dramatically reduce the severity of the heart attack. In fact, many lives have been saved because paramedics started treatment before even reaching the hospital. When the patient arrives at the emergency room, doctors immediately focus on one thing: restoring blood flow to the blocked artery. Time is muscle. The longer the artery stays blocked, the more heart cells die, and the more permanent the damage becomes. Doctors begin by confirming the diagnosis with an ECG and blood tests that detect heart enzymes released when heart cells are injured. If the tests show that a major artery is blocked, the treatment plan becomes urgent and direct. One of the fastest and most effective treatments is a procedure called angioplasty, also known as PCI. During this procedure, doctors insert a thin tube through an artery, usually in the wrist or groin, and guide it all the way to the heart. When they reach the blocked spot, they inflate a small balloon to push aside the plaque and reopen the artery.